Well, it's my pleasure today to introduce our next speaker, who is Dr. Laura Csere. Dr. Laura is a psychiatrist. Her background is she got her bachelor's degree, I think, at the University of Tampa. Is that right? And she got it in biology. So she's very knowledgeable about the topic that she's talking about. She also, of course, has a medical degree. Now, I'm sure this is a disclaimer that you're not providing any medical advice.
Yes,
absolutely. But anyway, she's one of us. She's a member of our Rose Society, and so we're happy to have her as our speaker. And she will be talking about the medical uses of roses. I can't say medicinal uses of roses. So it's my pleasure to introduce Dr. Laura Csere.
Thank you, Ken, and thank you, Malcolm, for all your help with getting everything set up in the AV department. That is not my specialty, so I really appreciate all the assistance with that. All right, and can everyone see? It's not too bright, is it? Are the lights okay? Okay. All right, so first of all, it's just really good to actually see everyone in real life. It's been a long time. And also, it's just a special opportunity to be back at Florida Southern College, which I think has one of the most beautiful rose gardens I've ever experienced. So it's really nice to be able to be back here. And I think I see all familiar faces, but if there's anyone new here today, welcome. We're very happy that you're here, and I'm happy that you are present for this presentation. All right. Okay, so for anyone who doesn't know my name, I am Laura Csere. I've been a member of this Rose Society for some years now. I joined after attending a meeting with my mom, Debbie, who's in the crowd over there. If you want to say hi, Mama. I'm a rose enthusiast, but I am not a rose expert. So I know that there are a lot of folks in the crowd who have a lot more expertise than I do. So if there's anything that you feel you want to add, anything that you think needs an adjustment or correction, please raise your hand and let me know. I want everyone to have the best, most accurate information possible. So, okay, alrighty. I always learn a new thing or two every time I come to these meetings, so I'm hopeful that you all are going to learn some interesting new things today about the medicinal uses of roses. And I did give a presentation on this topic last year, but I've made a lot of changes and updates, so hopefully that will keep things interesting. And I've included some items that are relevant to the COVID-19 pandemic as well, and that's particularly timely. So, okay. Alrighty, so I do have this disclaimer, unfortunately, that I have to read, so I will do that now. So I've done my best to provide accurate content regarding the medicinal uses of roses, but herbal medicine is not an exact science. This lecture is intended for informational use only and should not be construed as medical advice. The medicinal uses of roses described in this lecture are considered off-label, i.e. not FDA approved. And there are some examples that I'll give that are more from folk medicine or traditional medicine. So I don't make any claim as to the efficacy of roses listed for medicinal purposes, and anyone wishing to use roses or other plants for medicinal purposes is advised to consult his or her own medical professional. I know that's a lot of legalese, but I have to do it, so there's that, and now we can get started. Okay. All right. So there are numerous species in the genus Rosa. Some sources I looked up said about 100, others said almost 300 species, so I'm not sure really what's accurate. Malcolm maybe could help us out. Do you know? Do you have a better estimate as far as the number?
It's opinion of the taxonomist.
Oh yeah? Okay. All right. Well, there you have it. Okay. So there are a lot of different species in this genus, but there are some that are particularly noteworthy species because of their medicinal use. And some of these include the lovely Rosa rugosa, which is featured here. I took that picture along the shores of Puget Sound in Seattle a few years back, and I think it's just a very beautiful rose. Also Rosa canina, Rosa damascena, Rosa labigata, Rosa chinensis, Rosa daverica, Rosa multiflora, which you can see here in this photograph that's from the USDA Forest Service. I you might already know this, that it's considered an invasive species. I did not know that, so this was new to me when I was doing this research, but apparently it forms such dense thickets that it can really crowd out pasture and drive out and kind of suffocate native species. So it is considered invasive, but it is still a beautiful, beautiful rose. Rosa simosa, Rosa odorata, Rosa roxburghii, Rosa davidii, if I'm saying that right, and Rosa soliana. And I'm curious, just to kind of have a show of hands, is there anyone here that did not know some of these? Are these all kind of old hat, or some of these new to folks in the crowd? Some new. Okay, good. Good. All righty. So these are just some of the noteworthy species of roses that have some medicinal use. Okay. So now that we've introduced the names of some of these species, which are studied and used for medicinal purposes, let's take a closer look at the chemical constituents that are in these species, starting with flavonoids. Are you all familiar with those? Yeah, I see a lot of nods. Okay. So flavonoids are a type of nutrient found in plants, and it's thought to be the main active ingredient in the medicinal properties of the genus Rosa. There are 6 primary different types of flavonoids, and these are flavanols, flavones, flavin-3-ols, flavanones, anthocyanidins, and isoflavones. And anthocyanidins have gotten a lot of attention lately in the last handful of years for their neuroprotective effects, very beneficial from a cognitive standpoint. Present in a lot of dark fruits and berries. Flavonoids have anti-inflammatory effects, and we know that eating a diet rich in these phytonutrients can reduce the risk of cardiovascular disease, diabetes, and certain types of cancers, including breast, prostate, and colorectal cancers. Flavonoids have been isolated specifically from Rosa rugosa, Rosa lavigata, Rosa canina, and Rosa roxburghii. And out of those, the total flavonoids in the fruits of Rosa lavigata was the highest. So that's a particularly important kind of special rose. Flavonoids are also found in many other types of foods. Like I mentioned, berries, especially blackberries. Blackberries actually contain all 6 different types of flavonoids. Red cabbage, kale, parsley is another one as well. Tea, green tea, black tea, both of them. Red wine, dark chocolate, some really tasty things on this list. Citrus fruits and soybeans as well. Okay, so another main chemical compound present in rose species that have medicinal properties are triterpenoids. I'm not sure if you all were familiar with these before today. I certainly wasn't, but triterpenoids, they represent the largest group of phytochemicals or chemicals that are derived from plants. They're widely distributed in many plants of the Rosa genus, but they're found mainly in the roots, leaves, and fruits of Rosa lavigata, the roots of Rosa multiflora, the roots of Rosa odorata, and the fruits of Rosa soliana. Okay. So if we can take a closer look at one of the roses with an especially high content of beneficial compounds, this is Rosa lavigata, or the Cherokee rose, which I think we would all be familiar with, given the name of our group. Okay, so the common name is the Cherokee rose, and this picture, which I thought was very pretty, is from the North Carolina Extension Gardener Plant Toolbox website, which is actually a really great website. If you all have a chance to check it out, they have a lot of very, very interesting information on there. The Cherokee rose is described as a vigorous, climbing, semi-evergreen vine, which can spread rapidly with arching canes that contain numerous hooked prickles, glossy dark green leaves, and showy fragrant white flowers. I just love that description. I think it's a really beautiful description of this rose. So we're going to take a little bit of a closer look at these triterpenoids and why they're beneficial to people. So these are used for anti-inflammatory, analgesic, which means pain relieving, and antipyretic, which is fever reducing effects. And they also have antimicrobial and antiviral activity as well. something I thought was pretty fascinating is that some have been reported to exhibit cytotoxicity against a variety of cancer cells without toxicity to normal cells. So they can actually induce cell death in certain types of cancer cells while preserving the normal tissue around those tumors. So that's pretty, it's pretty incredible when you think about it. Alrighty. This rose I had never heard of. My mom had. We talked about it in the car, but I was not familiar with this one. So this is Rosa Soliana, also called Soli's rose. And this particular rose has a very high content of beneficial triterpenoids. It's described by the Royal Horticultural Society in the UK as a very robust shrub up to 10 or 12 feet high, forming what they call an impenetrable tangle of branches, wider than it is high. It has small, white, single flowers in the early summer, and these are often fragrant. And I've never smelled this particular rose, so I'm not sure what it actually smells like, and I'm really curious if anyone has smelled this rose, if they could give a description, because I don't know what it's like. Does anyone have this rose at home or has maybe smelled it before? Could give us a little bit of a description? No? No?
I've seen it in Britain. I've probably put my nose in it, but I don't remember the fragrance. It's one of those big once flowering climbers that would probably never flower in Lakeland. In
Gotcha.
Gainesville, you might get it to flower, but it needs a little bit of winter, I think.
I see, okay, gotcha, all right. Well, thank you for that. Okay. And here's a picture of the fruits of Rosa Soliana. And in those fruits, like we learned a minute ago, they're very high in triterpenoid content. And this picture is from the Cambridge University Botanic Garden website, another really lovely website with a lot of information about roses and really beautiful photography as well. And any source that I use in this talk today, I have all the the credits here, and if anyone wants to take a look or get a link to anything, please let me know, and I'm happy to provide that as well. Okay. Great. So tannins are yet another chemical compound found in certain rose species that are medicinal. I always think of wine when I think of tannins, and I always think of tannins as being kind of a bad thing. As someone who gets migraines, I always think you want low tannins. Tannins are bad, but actually tannins are not all bad, as it turns out, and they serve a specific function. Tannins are a bitter chemical compound, and they exist in the seeds, the roots, and the flowers of some plants in the Rosa genus. And I believe it's to prevent animals from eating them when they're not ripe. It helps to somehow propagate the seeds, is my understanding. So you don't want you want the seed to be developed and the fruit to be sweeter as it goes along, if that makes sense. So okay. So tannins are found in the following: Rosa chinensis, flowers of Rosa rugosa, roots of Rosa simosa, roots of Rosa multiflora, and fruits of Rosa lavigata. And I never knew what was in roses, so this was all very new and different for me to learn about these different compounds. All right, so does anyone recognize this right away before looking at the name? No? So this is Rosa chinensis, or the China rose. And this picture is from the North Carolina Extension Gardener Plant Toolbox website, which I mentioned a minute ago. They describe the rose as a shrub with 2-inch single or semi-double flowers in the summer, borne single or multiple, fragrant and drought tolerant. Of course, we don't have a problem with drought here recently, but still something good to know. Alrighty, so the next main chemical compound present in some of these rose species are polysaccharides, and those are basically carbohydrates or sugars that are bound together. Polysaccharides, there are at least 10 different polysaccharides which have been reported in the genus Rosa, and these have some of the most impressive qualities, I think. They've been used for anti-inflammatory purposes and antioxidant activity. And there was a particular study that found Rosa devarica, the polysaccharides present in that rose, were found to actually inhibit human neutrophil, that's a white blood cell type, neutrophil migration and reduce neutrophil infiltration, which basically makes it a possible replacement for something like, let's say, ibuprofen or Aleve. You know, it's basically acting like a non-steroidal anti-inflammatory, which is really pretty cool. We can find in nature and not just in the drugstore. So that's actually pretty neat. And the last two of the main chemical compounds that we're going to touch on are the carotenoids, which are dietary antioxidants, and they give the example lycopene, beta-carotene, traces of lutein and zeaxanthin that are found in rose hips. And then I think we all know that rose hips are kind of celebrated for containing vitamin C, and that amount can really vary broadly from rose to rose, so they're not all the same. But the Rosa canina, rose hips, for example, have a particularly high concentration. Vitamin C is really important. We always think of it with, cold prevention. In the wintertime, we take, our emergency or vitamin C, whatever it might be, to try to hopefully avoid getting a cold. But vitamin C has a lot of different important properties. It's an antioxidant that can protect against damage caused by harmful molecules called free radicals, as well as toxic chemicals and pollutants like cigarette smoke, for example, which was news to me, so I did not know that vitamin C could protect against that. Free radicals can build up, they can contribute to the development of conditions such as cancer, heart disease, and also arthritis. So vitamin C is kind of an ally in reducing the risk of these different conditions. Vitamin C is an antioxidant necessary for growth, development, and repair of all body tissues. It's involved in skin health, including formation of collagen. If anyone here is vegetarian or vegan, side note, you'll see a lot of different collagen supplements, right? But they usually contain something from cows, bovine gelatin, or what's called marine collagen, which is really just ground up fish bones. But there are vegetarian and vegan collagen supporting supplements that are really vitamin C heavy, because this is something that does help with collagen formation. So that's kind of a different alternative to some of the fish and cow products. There's a function of vitamin C in wound healing and also maintenance of cartilage, bones, and teeth as well. So vitamin C is kind of an important character here, and we know that is present in the rose hips, which is pretty neat. So the next rose on our list to highlight is Rosa simosa. I thought this was really interesting. The extract of the fruits of the species might actually fight leukemia by inhibiting tumor growth, and I did bring with me actually some of the many different journal articles that I'm referencing. And if anyone's interested to actually take a look at the full article, it's really pretty fascinating. Again, this is all news to me. I had no idea that roses were capable of helping in this way, but it turns out that they are. So they have actually been demonstrated to fight leukemia by inhibiting tumor growth directly. Polysaccharides from Rosa simosa fruits may protect against ovarian cancer specifically, and that's via what's called cytotoxic effects on ovarian cancer cells. So it's actually directly toxic to those cells and can induce cell death in that particular type of cancer. Okay. All right. So now that we've discussed some of the chemical compounds present, we're going to take a closer look at some of the specific pharmacologic activities. So starting with Rosa rugosa, this has pretty potent anti-inflammatory activity. It actually inhibits the production of different inflammatory markers, and some of these are prostaglandin 2, tumor necrosis alpha, interleukin 6, and interleukin 1b. And if you all are familiar with Singulair, the drug that helps people with allergies and asthma, it has actually some very similar properties to what's being described there. So it's really interesting that the flowers of this Rosa rugosa act similar to, a prescription drug, Singulair, as far as the anti-inflammatory effects. specifically against interleukin-6. So it's really kind of amazing stuff, I think. Something else I'd never heard of at all, Rosa canina. There are some preparations that have been made that have been used to treat osteoarthritis and to relieve pain, and it's through a similar fashion. It's reducing these pro-inflammatory cytokines, these highly inflammatory chemicals in the body. And we've heard about cytokines in the recent past with COVID-19, when the pandemic first started and people were very, very, very ill. We heard about that cytokine storm. If you've heard about that in the news, people would get this overwhelming immune response, and it would actually work against someone, unfortunately. So much inflammation trying to get rid of this virus that it actually worsened people's outcomes and worsened their breathing. So this Rosa canina reduces those pro-inflammatory cytokines, those highly inflammatory chemicals. And so I think that's pretty amazing. And there are certain drugs, if you've heard of COX inhibitors, that are, again, sort of potent anti-inflammatory drugs, prescription drugs. Meloxicam is one of them. And Rosa canina actually has some properties that are very similar to meloxicam, which we use for all kinds of pain disorders. And we specifically see it used a lot in arthritis, pain management. And tell me if I'm talking too fast, because I might be. So slow me down if I need to. Please. Okay. All right. So another specific pharmacological activity of one of these roses, the Rosa rugosa. We talked about the beneficial effects of polysaccharides, or these sugar compounds extracted from this rose. So the actual petals can be purified from Rosa rugosa, and you have these polysaccharide compounds. And when you go in a lab and you use a cancer cell line called HeLa cells, it's basically a kind of human cervical cancer cell line, like clones of these cancer cells, and you can directly experiment on the anti-tumor properties using these cell lines, so that it's like a standardized cell line in research. And Rosa rugosa polysaccharides were actually shown to induce cell death in human cervical cancer cells and inhibit their proliferation and migration, so reducing the risk of essentially spread or metastasis. So there's actually, again, some pretty impressive properties here that I just had no idea existed at all. So it's pretty neat stuff.
Are there any commercial uses that take advantage of this?
So they're on their way. Like I'm so glad you asked that, because these articles are literally from the last few years, so it's very new. Some of them came out in March 2022. So I think that there's still a ways off before we could go to the drugstore and get one of these compounds or have a prescription with it. But I think it's going to be sooner than later, because the adverse side effects associated with them are much less than some of the chemotherapeutic drugs, like doxorubicin is one that I'll mention in a minute, and that has potentially adverse side effects, whereas these rose compounds can have the same efficacy, at least in this study, as doxorubicin, which is chemotherapy, but lacking the toxic effects on normal cells. So that's pretty incredible. I just had no idea. So I think we're getting there, to answer that question. I think we're getting there. I think it's probably going to be in the next handful of years. We just need to have more research, more confirmation, but definitely it looks really promising. So for sure. Okay. So this was an article specifically from the International Journal of Biological Macromolecules, which specifically talks about the polysaccharides from Rosa rugosa and their ability to induce cell death, which is called apoptosis. That's just a fancy word for cell death in human cervical cancer cells. And then this is a complicated pathway that I do not fully understand. This has been many years since I've done that level of detail of biochemistry. So if someone asks me a question about that, I will have to probably get back to you on that, on the very specific parts of that pathway. But suffice it to say that this polysaccharide does induce cell death in these human cervical cancer cells, which is a wonderful thing, because we really need more treatment options, Okay, so this is what I was mentioning a second ago about the doxorubicin. So the Rosa rugosa polysaccharides cytotoxic effects against cervical cancer were actually comparable in the study to the effects of doxorubicin, which is a prescription chemotherapy drug. So they actually had comparable effects, but they were found to be non-toxic to normal cells, as opposed to doxorubicin, which can be toxic to normal cells as well. So that's pretty incredible, and definitely considerable implications for the treatment of cancer using Rosa rugosa. I mean, I just never knew that there would be such a thing. Have any of you heard of any of these anti-tumor properties of Rosa rugosa before? Have you? No. No. Okay. I hadn't either. Okay. Just want to make sure that this is newsworthy. Okay. So let's go back and let's take another look at a specific type of rose. So Rosa damascena, also called the damask rose, is in this picture here. I just think it's a very lovely picture. And the description on the Heirloom Roses website is as follows. Damask roses are one of the oldest rose varieties that have given birth to thousands of new varieties while still maintaining their own unique heritage. It's a highly fragrant shrub rose, typically known for its sprawling growth habits. It can reach up to 7 feet in height, and the blooms are held on open, airy branches and are almost always clear pink in color. And I think we do kind of immediately think of essential oil, at least I do. When I think of damask rose, I think, okay, like a very pure essential oil of rose. I can imagine what that would be. Okay. Do these grow well here, Malcolm? They do? Okay.
They do.
Okay, so this was another interesting article out of a medical journal called Sleep Medicine. And this was looking at using different kinds of inhalation aromatherapy with this damascena oil on improving sleep quality. So it was actually using it as essentially a sedative. Instead of taking, NyQuil or Ambien, maybe we could just inhale some Rosa damascena oil and get some better quality sleep. So it's actually a systematic review. So it was looking at a variety of different studies, actually not just one. And it was demonstrated that the inhalation of Rosa damascena significantly improved sleep quality. Unfortunately, though, some people had some adverse side effects, which were not pleasant. So headache, nausea, and vomiting were on the list. So I feel like it's a real mixed bag, this one, unfortunately. So a word of caution about inhaling this stuff. But for most people, it was found to be helpful in the study. Okay. So this I thought was really interesting with the COVID-19 pandemic. So this was a study out of an anesthesia journal, and they were looking at the effects of inhalation aromatherapy with the Rosa damascena oil, not on the patients, but on the operating room personnel that were actually treating people during the COVID-19 pandemic. So
fall asleep.
especially, right? As you're operating, and then that can be really bad. That can be really, really bad. You're right. But especially at the start of the pandemic, we heard a lot about doctor and nurse, burnout and surgical tech burnout because you're working around the clock and you're working against this foe that you don't understand, and why is it here and how does it work, and it's just incredibly stressful. So this particular study was looking at the effects of this on the actual operating room personnel, not the patients. And it was found to be helpful. Indeed, it was actually found to be helpful. And the methods that they used, I thought this was interesting. They had, the staff would inhale 2 drops of this oil for 10 minutes at the start of their morning shift. So, as they're starting work, they're going to do this aromatherapy, and they're going to do it for 10 minutes. Now, to me, inhaling the same smell for 10 minutes sounds kind of awful. Truthfully, it just sounds too strong to me, but I know a lot of folks really do really like aromatherapy and using something strong, even like a rose smell. So they would use this inhalation at the start of their shift, and then at nighttime, they had these little cloths that were soaked in the oil, 5 drops of oil, and the control group was paraffin, so just like a wax without a scent, to compare between the two. So they would attach this little cloth to one side of their pillow, and they had to use it nightly for 30 consecutive nights. So this is actually kind of like an intense thing. And sure enough, the people who were in that test group using this rose oil actually did have less anxiety. They had less trouble falling asleep and staying asleep. So it actually did help people. And again, it's like who would have known?
Okay.
Another kind of highlight about rose medicinal uses of roses during the COVID-19 pandemic, and I'm sure that we all have either had it or known someone who had it, where you lose your sense of smell, which can also, and your taste. Absolutely. And the numbers kind of vary, and it's varied with different strains of the virus, variants of the virus. But when you look up the numbers, it's about 70 to 80% of people who will contract COVID-19 will have some degree of loss of sense of smell or taste. And it's especially common amongst people who actually have mild cases of COVID. So they're not in the ICU necessarily, they're not, on death's door having, a really terrible time, but they lose their sense of smell. And that on its own can really be dangerous. We don't think of it necessarily as being dangerous, but if you can't smell, fire, you're left something on the stove, now the house is going to burn down, and you have no idea, that's actually very dangerous. Or if you're going to eat something and it's spoiled, usually we rely on that sense of smell to tell us, if this is still fresh, and if it's not, it can be a real problem. I actually have a patient who lost his sense of smell, but due to radiation therapy for a kind of cancer that's unrelated to what we're discussing today, but he has no sense of smell and did not know that there was literally a dead rat, poor rat, in his house, for weeks, and he had no idea. And so neighbors were kind of concerned, and people came by, and he had no idea. So it just goes to show you that really your sense of smell is actually very important, and of course it helps us to really enjoy our food. So people is that people can use so-called scent training to help regain their sense of smell faster when they've lost it due to COVID. Have you all heard of this scent training before, by any chance? It's a kind of a specific way of using common, easily recognizable scents, and actually every day. Typically it's about 2 to 4 times daily for at least 24 weeks. And it's recommended to try at least 4 different aromas, and one of them is rose, the scent of rose. So using rose, some people use coffee, lavender. I've seen lemon be used. I'm trying to think if there's anything else. I think rosemary might be one. But you basically put out these little scents, and you just take some time out of your day, and you go through and you smell them all. And you try to imagine that smell, the way that you can remember it. Even if you can't smell a darn thing, you just kind of, in your own mind, try to remember the last time you smelled it and what that was like. And doing this kind of scent training, like I said, can actually help people to regain their sense of smell faster. And our good old friend, the rose, is one of those, allies here with helping people regain their sense of smell from COVID. So it's pretty darn neat. And I don't know how much time I have, and I don't want to go over, so I want to be careful. When do I need to end by?
Keep going, you're doing fine.
Yeah? Okay. Because the next part is kind of throwback to last year's presentation, where I talked a little bit more about different folk remedies and traditional remedies using roses. And I think some of them are really interesting, so hopefully you all will agree and we can kind of take a look at them. But this first slide is just highlighting some of the aromatic components of roses. When we smell a rose, what is that? Well, it's partly geraniol, citronellol, etc. So these are some of the chemical compounds that make a rose smell like a rose. And this particular rose is Rosa gallica officinalis, or the apothecary rose. And this picture is from the Massachusetts Medical Society Medicinal Garden, which I think is pretty neat that they have such a thing. And let's see, from the Help Me Find website, which I learned about through this group, by the way, they describe this particular rose as being deep pink to carmine red, has a strong fragrance, has medium semi-double 9 to 16 petals, cupped bloom, a width of 3 feet, And it looks like it is listed as an old garden rose, i.e. before 1867, and I hope that that is accurate. Yes, I see some people nodding, so that's good. Okay. So why, what is it that's special about this particular rose? A little bit more about the history. It's native to Iran and Persia, cultivated for approximately 3,000 years, which is pretty incredible. And the flowers are gathered in the summertime. It was described as the queen of flowers by ancient Greek poet Sappho. It was used in ancient Rome in festivities. It was consumed as a type of food and also marinated in wine, supposedly as a cure for hangovers, which is interesting. And actually in Iran today, people do still use a lot of roses. I have a friend who's originally from Iran, and her family essentially escaped to the U.S., and she lives in Washington State, and she actually collects the Rosa rugosa petals that I mentioned before that were along Puget Sound. She actually collects those by hand, and she makes homemade rose jelly, which I just think sounds so good, and it's used in different desserts and other Persian foods. So they still use it. It was used in Europe in the Middle Ages. Monks sometimes would grow the Rosa gallica officinalis in their gardens for use as aromatherapy to treat depression. And I think, smelling a wonderful flower really does lift your spirits a bit. It's always a happy thing, I think, to be able to smell a really wonderful flower. And in 19th century France, French pharmacists grew them in pots at shop entrances, and that's how they got this name of apothecary rose. And some of the reported uses were to treat indigestion, sore throat, and skin rash. So kind of a little bit of this, a little bit of that. The parts that are utilized are the flowers made into an essential oil. Supposedly the petals can reduce high cholesterol. The rose water has a mildly astringent property that you can use to clean your face. In fact, actually rose water, toners are, I've seen them before in the drugstore, I've seen them, in stores before. So rose water can be used in that way as well. It can be used as a mild sedative and an anti-inflammatory remedy also. And then some of the constituents that we already talked about that are aromatic compounds are the geraniol, the nerol, citronellol, etc. All right, so the next one up is Rosa canina, or the dog rose. So I know we talked a lot about this already, but this is some additional information that I had described last year that I thought was interesting. So here is a picture of the rose hips from Rosa canina. The hips are used to make wine in Bulgaria and medicinal tea in syrup. You want to avoid eating the hairs or the spines on the seeds. Apparently they're very unpleasant and can be dangerous if you swallow them. The flowers can be used to make rose water for flavoring. We think of Turkish delight as being a rose flavored dessert, and that's one use. The hips contain vitamin C, A, B1, which is thiamine, B2, B3, and K, and then we mentioned these others earlier. And B1, which is thiamine, has a really important role with cognition and neuroprotection. When people are thiamine deficient, they can get something called Wernicke's encephalopathy, which can be a terrible thing. You can have a delirium and dementia. If you don't treat it, if you don't replenish that B1, you can actually get something called Korsakoff psychosis, which is a very wretched thing, and that can be irreversible. And you see this sometimes in people who overuse alcohol. When we get older already, we have flattening of what's called the gastric villi, these little tiny finger-like projections in our GI tracts that absorb certain nutrients. And so as we get older, they tend to flatten. They don't do as good of a job. They can't really grab these nutrients like B1 or B12 as easily anymore. And then if we drink too much, it makes them even flatter. So then we're even having a harder time to absorb these vitamins like B1. And that can then predispose someone to having this terrible Wernicke's encephalopathy or Korsakoff psychosis. So B1 is an important vitamin, I guess, is what I'm saying here, and it's found in Rosa canina. Okay, so sort of a general description of Rosa canina. It's a climbing perennial, about 10 feet tall, has curved thorns, leaves with 2 to 3 pairs of toothed leaflets. It's usually pale pink, but can vary from deep pink to white flowers. It has scarlet hips. It's native to Europe and temperate areas of Asia and North Africa. It grows in hedgerows, thickets, and open areas. And the hips of the rose are gathered in the autumn. It does have medicinal use. Fresh rose hip syrup may be used as a gentle remedy for diarrhea or as a mild diuretic. It's used in traditional Austrian medicine to make tea to treat viral infections and also kidney and urinary tract disorders. The essential oil from the petals can be used to reduce anxiety, to relieve muscle tension, and also to decrease inflammation. There is some research, I mean, again, we've talked about this before, but there is some research looking at rosehip extracts for the treatment of osteoarthritis, rheumatoid arthritis, and lower back pain because of that anti-inflammatory effect that I mentioned earlier. Okay. And again, I know we talked about this Rosa rugosa quite a bit, the beach rose, but I have some additional information here from last year that I wanted to touch on as well. So it is a leafy shrub, 4 to 6 feet, dark green, lustrous leaves. The stout stems are densely covered in fine thorns. The flowers are large, single, 4 to 8 petals, moderate fragrance. It's a species of wild type, native of China, but has a wide range of adaptability. I've seen this all over the place, I feel. I don't know if it's really, I don't know if I've seen it here actually wild. Does it grow wild here? No. Okay. I've definitely seen it in more northern climes for sure. So the petals of the beach rose can be used to make teas, jams, wine, and juices. The petals, hips, and roots can be used for medicinal purposes. Again, the hips contain vitamin C and also flavonoids, which we've talked a lot about, so we won't go back to. But one of those in particular is quercetin, and that's thought to be helpful at promoting lung health and actually has some evidence at treating different kinds of small cell lung cancer, which is really kind of an interesting thing. And even some hospitals had on their protocol for the treatment of COVID-19 early in the pandemic as well because of the lung health promoting properties of that quercetin. Okay. Talked about the tannins already, but we didn't talk about their ability to have antimicrobial effects specifically against E. coli, Staphylococcus aureus, Bacillus cereus, and Salmonella. These are all very unpleasant bugs that you don't want to get, believe me. So it has some antimicrobial activity against those. The petals also have antifungal properties, and then the cytotoxic properties, which we already discussed. And it's interesting to think that even from last year till now, that there's new papers about this very rose, you know, that with the human cervical cell, the cancer cells, and some other studies that are new, that are coming out. So research is really ongoing, and it's pretty neat. The petals and the roots are used in some Asian countries in traditional medicine to treat diarrhea, gastroenteritis, dysmenorrhea, which is menstrual cramps, hepatitis, which would be inflammation of the liver, and then also pain. Okay. I think I just have a few more. I don't want to go over 40 minutes. I was told specifically to not go over 40 minutes. So I'm trying to think what else I can add here. Ken, how long have I been going on for? Yeah? Wrap it up? My mom's saying wrap it up. See? She'll tell me. Okay, well then in that case, yes, you had a question.
When you refer to tannins, is that similar to the tannins found in wine?
Yes, exactly. So it's the exact same thing. So they're found in a lot of different plants, and red wine skins being one of them, and all different kinds of wine actually. So it's in the actual skin. And it does give wine that certain kind of like a earthy but slightly bitter taste. Yes, so yes, exactly. Okay, so I will not keep going then, but I do want to ask if there's anything that I should go back to, or if you have any questions. Again, I'm not a rose expert, but I will certainly do my best to answer your question. Yes.
Do you have the resources?
Oh,
that
yeah.
you could show there?
I do.
Maybe I could put it in the...
Absolutely. They're in the presentation itself, and I can send you the original one
okay, perfect.
where it'll have literally all the sources. And what's interesting too, Lynn, is that I didn't even, because you could probably have a 4-hour talk on the medicinal uses of roses, believe it or not, because this year when I was doing a lot of specific journal research, I mean, there are tons of articles about roses being used in medicine research. I had no clue. I mean, so this whole stack, these are all studies in actual, medical journals that are looking at medicinal uses of roses, and a lot of them are from the last couple of years. So it's pretty neat. So yeah, all the sources are here, but then I also have, hard copies too, if you want to take a look as well.
You wonder how they lost all that information, because up until the time of, they started naming roses, which was in France, like we name them, they were only for medicine. That's all they were grown for, was for medicine.
Now, how interesting.
And Napoleon's wife started naming them, and then they became something pretty. It wasn't a misset, but all that information was before. That's
So you're
what
right.
they were
Where
used
did it-
for.
Where did it go? You're right. How did
where,
that get lost?
Where did the information go?
Gosh, I mean, isn't that something? Then you think about that library at Alexandra. Is that where that was? Where it just got burned down, forever ago. And you think, oh my gosh, can you imagine the wealth of information that was in that place before it burned down?
Well,
Probably
that's it.
so many
It's just
things.
like this was used at one time. Why did it go away? Because
You're right.
now we think of them as just something that smells pretty, or looks pretty.
Exactly, more ornamental, or
Yeah.
because they're beautiful, or they I
Because
mean,
that
but you're
was
right.
why they were propagated, was for their like, it's just, have you ever tasted like rose pie? Or
Yes,
rose?
I've had rose desserts, and I actually really like them. What about
It
you?
was strange. It
is
was
strange.
It was like, I'm supposed to be smelling this, not tasting this. or
Right?
something.
It's like almost confusing to the nose, and it
And
tastes
the
buds at
rose
first.
water's so simple, as long as you haven't sprayed the rose. You just take the petals, put it in the water, set it in the sunshine with a cover,
Oh,
and
really?
you have rose water.
Now tell me that again, because I might have to try that.
Well, as long as you haven't sprayed them,
Mhm.
because then you're gonna have the chemicals in it.
Oh, sure.
You just take the petals off, and you put them in water, put the cover on your quart jar or gallon, and set it in the sun. It's
Really?
like making tea,
How long do you leave it out for?
Do you know? I'd have to look it up. We did it in the beginning, we
Yeah.
tried all these different things.
Oh, that's really neat. I
People
didn't know
still
that you could
do
do
it.
that. That's a great. That's a
You can do
tip.
your
Like,
own.
You can do it yourself.
It's
Yeah.
used in cooking in the Mediterranean countries
Yes.
a lot.
Yes.
So you can buy it. You can buy bottles of rose
Of
water.
the rose water. I know. I
Cooking.
think in Persian food they do use that a lot as well,
Yeah.
and they combine it with pistachio. It seems like a lot of the time in
where I come
desserts.
from, Azerbaijan, we're bordering Iran, so we have the jam with rose petals. It's not really jelly, but it actually
Yeah.
rose petals.
What is that like? Do you like it? Is it
Oh
it
yeah,
good?
it does taste like if you would smell a rose.
Yeah,
It
that's
tastes
what
like that.
I
The
find.
consistency is a little funny because it's like sometimes
It's the wrong,
so,
I
That
think
like
it
gives
has
you a little
flavors.
tooth resistance.
Yeah.
Yeah.
You're biting into like
Right.
jam.
Right.
You get a little resistance from the petals.
Right.
Almost like a Turkish
it's
delight.
like